All right, welcome back to the KFYR Plus News Desk, and today is National HIV Testing Day. This is a day to encourage people to get tested for HIV, know their status, and get linked to care and treatment. Now, the theme for this year is Level Up Your Self-Love and Check Your Status, emphasizing valuing yourself and showing yourself compassion and respect and honoring your health needs with self-love. Knowing your HIV status helps you choose options to stay healthy. Now, joining me right now is the founder and CEO of Shine Bright and Live, which empowers individuals at risk or living with HIV in North Dakota. Let's welcome my old friend, Jason Grunick. Good afternoon, Jason.
Jay, thanks for having me back again.
You got it. So, Jason, can you tell us the significance of this day, National HIV Testing Day?
Yeah, definitely. Thank you for asking. So National HIV Testing Day was first observed, I think, in June 27th of 1995. They started it as a day to encourage people to get tested for HIV, to know their
Mhm.
status so that then they can get linked to care and treatment.
Sure. So, why is it important for people to get tested regularly?
Getting tested regularly truly is an act of self-care. You get to take charge of your health and future by protecting your health and the health of others. So it's recommended that everyone between the ages of 13 and 64 get an HIV test at least once as part of your
Hmm.
routine health care. And then people with certain risk factors should actually be getting tested at least once a year.
Of course, HIV knows no boundaries. So, how does the lack of infectious disease doctors in 80% of U.S. counties impact a day such as today, the testing and treatment?
So, Jay, it doesn't impact testing as much because of public health that we have across the state and nation. But as we see our funding for public health kind of depleted, it does become a bigger issue.
Hmm.
We're facing a crisis that many don't realize in rural North Dakota and America. One example when it comes to HIV treatment now with an infectious disease doctor or the lack thereof is that we're facing those living with HIV having to travel long distances to be seen by someone with experience in HIV treatment and care, and it could be getting worse, unfortunately.
Sure. Uh, so, how have previous funding cuts affected testing and treatment programs?
Well, Jay, since 1981, I had to dig a little bit here. There's
Okay.
only been two reductions in HIV/AIDS and funding, once in 2006 and once in 2012. Neither of those cuts have been on the scale of the proposed HIV funding cuts that are being talked about in the 2026 federal budget. We're looking at roughly $1.5 billion in HIV funding cuts facing the nation if this
Mm.
budget goes through intact. This could be devastating to the country and to those living with HIV in the United States, but this is just a proposed budget. So the hopes are that this won't come through with that full $1.5 billion cut.
Okay. So, how do you address the stigma associated with HIV testing in different communities?
Navigating testing in different communities is something that Shine Bright and Live is really invested in. We're reaching out to our tribal nations, our new immigrant communities to meet them where they're at. There's a
Hmm.
high stigma already in rural areas in North Dakota when it comes to HIV. So the
Yeah.
biggest thing, Jay, is education, access, and everyone sitting down at the table together is the way that we're combating stigma. Another great asset at our disposal so far is the advance of at-home testing. Then you aren't having to worry about facing that stigma as you go into those rural clinics or places of testing.
That's a great idea. So, how has the landscape of HIV testing and treatment changed over the past decade? As you mentioned, that at home testing is a game changer, really.
It truly is. We've seen some great advancements in HIV testing over the last decade. There's now a rapid HIV test and then that at-home testing that's available. Now, treatment has made HIV unable to be transmitted. A lot of people don't know about this. So long as you are on your medication, the sooner you get tested and get on that medication to become undetectable, the healthier your life will be. They've also come out now with an injectable HIV medication, so you're not taking pills every day. You get a shot every few months. And now it's been released that they're possibly in the works of a once a year shot to treat HIV, which would be game changing.
Are there any misconceptions that the public does not know about, whether it be HIV or even the testing?
There's a lot, and that's the big part about education and trying to get that education out there. Some of the big misconceptions are only certain people should be testing or getting HIV tests done, or they think I don't have multiple sexual partners, so I'm safe.
Mhm.
HIV testing means you're a person with poor morals, Jay, or a positive HIV test result is a death sentence, which is just untrue in today's day and age.
Yeah, I mean, there was a conversation in our reporters meeting that we had, and some of our reporters are a younger age, and
Mhm.
they probably didn't understand. And Jason, you can recall this, where we remember Magic Johnson was one of the first big celebrities. I think it was actually the lead singer for Queen who had passed away from HIV. So when we thought of
Yep.
HIV, one of the first things that it was a misconception that it was a death sentence, right?
It was. And that's what the mindset was. It literally was where we were at back then in the 80s and 90s, where it was a death sentence. But things, science and medicine have really progressed since then.
It's quite amazing, absolutely. How can individuals find their local HIV testing center, or, limited healthcare resources are out there in our rural communities? How can they find out more information if they'd like to get tested?
Right. So North Dakota Health and Human Services has a great one-stop shop page that they can search for. You just Google North Dakota Health and Human Services HIV testing, and it actually takes you to a page that lists locations all across the state, as well as it gives you that access to the free self-collection at-home testing program, which is really amazing.
Okay. Any policy changes that you think need to be improved to access HIV testing or treatments?
We need to understand that HIV funding for prevention and care is not only the humane thing to do, but it really is a cost saving that not providing these services and ending up waiting for the end result causes us more cost. When you see those increases in HIV cases, health issues, and ultimately a possible crisis we haven't seen since the 80s and 90s, investing in prevention and care is a good way to go.
And Jason, before we wrap things up, shine bright and live. Tell the viewers a little bit about your work.
Definitely. So Shine Bright and Live is the state's first ever HIV nonprofit. We started this in January of this year, 2025. And the big goal is to kind of meet the need and fill the gaps in service across the state to help with prevention and care and guiding people with a more humane whole health approach to HIV.
Fantastic. What message would you like to convey to those who may be hesitant to get tested?
Get tested for your peace of mind and those around you. HIV really is no longer a death sentence, so getting
Hmm.
diagnosed early and starting medications is the best way to go. The thing is, if you're negative, you're able to gain access to prevention such as PrEP, condoms, doxypep to combat STIs. And if you unfortunately are positive, there's a whole community waiting to walk you through that difficult time. It is better to know and get the help you need than to not know.
Yeah, fantastic. Jason Grunick of Shine Bright and Live. Thank you so much for your time today. I sure appreciate it. Say hi to your family for me, will you?
I will, Jay. You take care.
Thank you now. All right, 1238, quick break here at the news desk. We're back with more here on KFYR Plus next.